Yeah, I mean, I think in terms of gaps that need addressing for the LGBTQ community, I mean, and this is probably even wider than certainly within the kind of infant loss community. Um, I mean, I think in healthcare, certainly training for staff, and I mean, like I said, this really kind of covers a larger part of our healthcare system. Training for staff and doctors, and just to how to work with people from the community. And what are those kinds of words you should avoid? I mean, how understanding the process that may have brought, particularly within the family building process, that may have brought a couple to your clinic or to the IVF clinic, the fertility clinic. Maybe it's their first time, maybe they've been trying it, like my wife and I had for years. And I mean, some of this is probably also true for, I'm certainly for heterosexual couples too, in terms of that journey. But there's, I think, just training for how to be sensitive to the LGBTQ community and couples. Even small gestures, honestly, like really, really help. We talk about this at my work, actually, in terms of how to be more kind of open or outwardly acknowledging about support for different communities, and even having like a pride flag up, somewhere is like, oh, okay, great, like you get it. So I think that, just maybe training, some sort of kind of inclusivity training or implicit bias training, certainly surrounding LGBTQ community, as well as, I mean, this is one thing I always think is so simple, but the forms, man, the forms, just, I mean, that it was so apparent to me, and how hard that was to deal with when I had to like cross out, father on the forms I'm filling out for the funeral home, for my son that just died. I mean, that was just like really, really rough. So it seems to me to be such a simple thing just to change the forms to be gender neutral, parent, and even, I mean, my wife and I even decided, like, you can choose on the birth certificate, like, this is obviously everyone's choice, certainly, but we just wanted parent. And I certainly think to maybe a recognition of where, if you are in the unfortunate situation where you have lost a child, helping to understand, particularly for different kinds of groups, and I think this is true for the LGBTQ community as well as other people, where can you go to get specific counseling that would fit with kind of your family, and it could be cultural as well, different kind of cultural groups. So I think that might be something that would be good as well, and even, letting them know and talking about, hey, be open, like this is going to be rough. We had one nurse at the hospital who kind of was our last nurse we had there, and she had actually lost a son as well. It was about 10 years prior. But from her, she was the most kind of astute with us, then really like straightforward. She's like, this is going to be rough, like, don't be afraid to get counseling, don't be afraid if you need to take medication, don't be afraid if you need to, all those things, and it was so nice to hear her say that, because we were just at a total loss. So I think just more recognition around, there was a social worker at the hospital, but I mean, I think she literally just handed us the forms for like the funeral home, and that was about it. So really having an individual that's trained in dealing with different communities to help guide them into areas where they can get counseling, and not just kind of not making it seem like an afterthought, but something that's important for you to do. Because I mean, like I said, I really credit the support groups that we joined immediately, and then our professional therapist who really helped us kind of accept what happened, to be honest, and to be able to include that in our life. It's just part of our life journey. You don't move beyond it. It just becomes part of you, and part of who you are, and part of your family.